Okay, we are live now. I'm leaving.
Assalamualaikum everyone, this is me Sananati Sheikh, and
जी
today
जी
I'm
वालेकुम सलाम।
in this session with the collaboration with the Instacare and the Scotland. And today our topic is about the vitamin D deficiency in the awareness. As you know, Instacare is a platform that has been built up a bridge to patient between the patient and the right healthcare providers. Our focus is to improve the quality of healthcare ecosystem by making it accessible and affordable for everyone. So, welcome to board, Dr. Shehla. How are you?
Thank you for inviting me over.
Okay. Can you please introduce yourself on this platform?
I'm Dr. Shehla Akram. I am
Okay.
I practice hospital nutrition
Okay.
nowadays, and I'm doing this for the last. I introduced nutrition in Pakistan.
Okay. That sounds great. Okay, Dr. Shehla, today's our topic, as you know, that we are going to discuss on the vitamin D awareness, and the whole month we are going to celebrate about this topic before. So, our first question is first, we want to know about what is vitamin D and why does our body need it?
Vitamin D is for the bones. That is very simple. It's for the
Mhm.
bones, and when there is a deficiency, and if it is earlier stage of your life, if there's a deficiency, then also it gives you like problems like the bending of the bones, and then the stunting of the child, so low height, stunting height, and
Mhm.
bones are bending. So these are like, I mean, they actually are very the appearance, the body appearance is actually pretty disturbed when the deficiency is early in life. And if it is like later on in life, these symptoms, the signs and symptoms are not very, like I would say, very strong, but they have a value of nuisance value for the patient. For example,
Dr. Sheila, your voice is not clear. I can't hear you. Your voice is not clear. डॉक्टर शैला योर वॉइस इज नॉट क्लियर आपकी आवाज नहीं आ रही है आवाज रुक गई है आपकी साइड से डॉक्टर शैला योर वॉइस इज नॉट ऑडिबल बिफोर इट्स फाइन बट नाउ इट्स नॉट ऑडिबल कैन यू hear me but Dr. Shailer, from your side a voice is not audible. I think there is some connection problem.
mic is on.
Now it's fine.
I really don't know what to do now.
Now it's fine. Your voice is clear.
Now is it
As you
clear?
click on the button, yeah. Now you just
Okay.
click on the button. Now it's audible. Thank you.
Okay. Okay.
Okay, now we are going to start. Let's continue our session. That's our question is, how much vitamin D does a body need
No, I
specifically
was
here?
trying to finish that. That with
Okay.
as the deficiency is in, like in adolescents or in women when they're pregnant or
Mhm.
childbearing age. So this is more of a nuisance. This vitamin D deficiency,
Fine.
um, some like mild deficiency, and they usually complain of hair fall, aches and pains,
Mhm.
stress, depression. So all these items, they actually bother your life a lot. Though the values are not very low, but they are on the low side. So what I mean to say is that vitamin D has a very crucial role to play in our lives. And recently, when we did a study in COVID, during these 2 years, we we found out that vitamin D is very important to boost your immunity.
Mhm.
And those people who had a good level of vitamin D had COVID, but they had a very mild attack of COVID even without vaccination.
Oh.
And then we started giving, once we found it out, then we started giving heavy dose of vitamin D to the admitted COVID patients to see that how they respond to the disease, and they did very well. So then we started promoting that this also boosts immunity, and this gives a great boost to the immunity, because with immunity they were better fighters. So the final thing I would say about vitamin D here is that in addition to the minor problems, signs and symptoms that the women or the men have, this immunity maintenance and boost immunity boosting is very typical to vitamin D. So if we keep our levels high, we can be sure that at least these minor diseases, along with the major attack of COVID and all, you can actually survive through in a very good way. So that is, it doesn't prevent you from catching COVID, but it makes you a better fighter.
Okay. Okay. What do you think? What are the basic sources can we can take for make our immune system much better?
Now the
Sources of
problem
vitamin D.
that main is the sunlight. Main is the sunlight.
Mhm.
That is, I mean, if you expose yourself for half an hour per day, you can actually complete your requirement for the day. But otherwise, and then the exposure, the body exposed to sunlight has to be about 60%. That means you have to be like your legs should be show a little like till the knees, your arms should show full arms, and obviously your face is not covered. And that sort of exposure, only then we can say that half an hour of such exposure can give you a protection for the day, like it can build up vitamin D for the whole day. But this is actually not possible in our country because we are very too finicky about our complexion and about the color of
Mhm.
the skin. And we actually don't like sunlight because we don't have that sort of a tolerance to high temperature. And I mean, there's so many things, plus plus plus. And then because of now dengue, again the morning exposure is again affected. So these also, and then the smog. I mean, smog doesn't
Mhm.
let the sunlight come down to make to, even if we expose our body due to smog, it won't have that sort of an effect to to produce the vitamin D from the body. So that sort of a problem is one, that sunlight, which we actually are not lucky enough to utilize. Then is the food. Now the food is mainly the fish and the fish and fish like seafood. And then all like fish oils, you can get it in capsules, but that also doesn't really um, guarantee a build up level
Mhm.
of vitamin D. But uh, if you regularly take fish, that actually can give some sort of a guarantee that you would not be having this vitamin D deficiency. Now, if you talk of those people in Europe and in these countries where they go for sun, when there's sun, and then they are all fish eaters, so they have a much better population, much better, a heavy population, percentage of population doesn't have the vitamin D deficiency. In our country, 80% of the population has vitamin D deficiency. So there's a lot
Fine.
of contrast. And then, I mean, we are usually, we prefer to go out of a house, leave a house by evening when there is no sun. So our habits, and then we are not very keen on walking, and we're not very keen on exercising. So all these things, they add up to the deficiency of these vitamin.
Fine. So, Dr. Shehla, we want to know that can we take the fatty acids or a fish code liver oils, you can say omega-3 fatty acids? What do you think about these sources?
Well, I did comment that, I mean, it is a good habit if you take it, but it is not a replacement for fish itself. So, I mean, with
Okay.
fish, we can do that. If you regularly take fish eaters, and they don't have this sort of a deficiency. With fish oil, how much guarantee do we give? I mean, I don't have the percentage at this time, that if you regularly take fish oil capsules and omega-3, then does it actually help in uh, recovering your deficiency? It might help in maintaining your levels of vitamin D, but if you are deficient, you can't just depend on the capsules that they will bring up the level. I mean, that is for sure. So when you are deficient in vitamin D, you have to take it regularly.
Again, we can't listen you. I think something is, yes.
Now,
Now it's better.
so that's what I said, that and there's also one thing more, that generally in Pakistan, now,
Now it's better.
okay, so in Pakistan, what we've studied is that uh, our population, because of the habits, their lifestyle, which has been there for years with them,
Hmm.
once they get they're always deficient.
Okay.
Once they're deficient, they're always deficient. So if they are, suppose they get a blood test now, and it is found that they're deficient, the doctor recommends them a course of vitamin D for 3 months or four
Mhm.
months, and then it doesn't mean that they are good forever. They have to keep an eye on the levels, because they're bound to go down again after 3 4 months. So this course has to be repeated again and again. So that is what we say, that once they're vitamin D deficient, they remain vitamin D deficient. They have to be on the watch out. They have to repeat the levels of at a regular intervals, and then they have to be on the watch out, and then take the replacement again. That is like, because, or they change the lifestyle, like they are
Fine.
more like they inculcate the habit of going into the sun, eating the fish and this capsules, and this sort of a thing. They have to change their lifestyle, then only one can think that maybe then these people will not be needing vitamin C after, once the levels is high.
Fine. Okay, what sort of vitamin supplements you can recommend in this to cover up this deficiency of vitamin D?
I am not very clear with your question.
I'm asking about the supplements. Is there any replacement of the supplements that we can use to cover
I,
up these
I told you that
deficiencies?
vitamin D is available as a supplement.
Okay.
But I mean, what is your direct question? You want me to take some names of the brands?
Yeah. Yeah.
I mean, like thing is that vitamin D, there are quite a few companies in Pakistan who are
Mhm.
manufacturing, who are this filling vitamin D or manufacturing vitamin D, and but there are some companies who have like they make vials only, and then they don't make capsules. There are others who make a capsule which is on a monthly dose, and so many things. They have the
Mm-hmm.
choices.
Yes.
But one of the companies, which is Scottman, they have all the range. They have the complete range.
Mm-hmm.
They have
Yes.
the vials, they have the daily dose, they have the stat dose, they have the monthly dose, they have the weekly dose. So that gives you more flexibility. It depends. Suppose if it is me, I would like to go for a daily dose so that I don't forget,
Mm-hmm.
and I take it daily. I don't really rely on a monthly dose. But there are others who are happy with a monthly dose, so it gives you a lot of flexibility. Scotland Sunny D, that since they have so many presentations, so it's easy to go choose one.
Fine. Okay. Can you recommend those supplements for the pregnant women who are pregnant, and what sort of dose they want to need in daily
It all
routine?
depends what is the level. If she is just on a
Okay.
if she is only on a maintenance dose, then it is 10,000
Okay.
units per day. But if it is like she is low, then obviously it has to be seen, because she can be on 2 vials a month, she can be on a stat dose per week. It all depends what is the level, but a maintenance dose of 10,000 per day is also available. So if she is like okay, then even 10,000 is fine.
Fine. Okay. What are the basic consequences if the vitamin D deficiency is unchecked in any person? If it's unchecked.
I told you, I mean, if the child is in the growing stage,
Mm.
then it gives you deformities. If you are in adolescent and childbearing age, and these um, what do you mean, like pregnant women, then
Mm-hmm.
they have the different problems that as I told you, that it is again I can repeat that it is aches and pains, it is sleeplessness, it is hair
Mm-hmm.
loss, it is stress. But in pregnant women also, if it is low, it can result in low birth weight child also.
Okay. Does it vary to gender or in a lifestyle?
Gender to gender, I mean, it is more common in women than in
Mhm.
men. Yes,
Okay.
but
Okay.
men
And
also have a
what?
deficiency, but it is more common in women than men.
Okay, fine. Okay, and what it also depends on the lifestyle that what we have in our daily routine. A voice stopped. Dr. Sheila, your voice is stopped.
Now, lifestyle, I've just
No.
mentioned it, that, if they are not in a habit of going out in the sun,
Mm-hmm. Okay.
if the
We are discussing about the vitamin D deficiencies and how we can cover up. What are the basic sources?
okay,
Now it's
can you
audible.
hear me?
Yeah, now I
All
can hear
right.
you.
So yeah, but it is more common in women than in men. And lifestyle, yes, because if they're not in a habit of going out, and
Mm-hmm.
like in Europe, I mean, they are usually out. I mean, on the roads, and
Mm-hmm.
I mean, they are out of the house, so they are exposed to sunlight. But here, the women are very reluctant to go out, and then the eating habits, as I just mentioned.
Mm-hmm.
So these sorts of lifestyles is like a permanent thing with them, and it's very difficult to convince them to change this lifestyle. So, I mean, anything else I can add now?
Okay, I want to know about the three things that needs to be at in the vitamin D that's essential for our body.
The food
Three main things.
items,
Yeah,
like the
food
lifestyle,
and say, or
sunlight,
physical
exposure to
exercises.
exposure to sunlight and exercise.
Mhm. Yeah.
Then going more for fish and seafood. Also,
Mm-hmm.
nuts also play a role. Like almonds is also another nut, which is pretty
Yes.
important in helping it building up in helping building up the vitamin D,
Mhm.
and that's also very important. And then have your blood test done for the for levels of vitamin C, because it is 80% of the population is having this deficiency. So it is always better to go for one and to know about the levels.
Fine. I think what sort of advice you want to give to all the mothers or the sisters that have are facing this deficiency of vitamin D?
Hello.
Yes, I want to know about the advice of the day.
Yes, my voice is audible. I'm looking for Dr. Shehla is here. If she is here, then we can join back because due to disconnectivity, I just missed the session.
Sana, the question visible to you?
Yeah. No,
Okay,
Dr.
I'm
Sheila is
just
not
calling.
here.
Yes, she's not here. I'm just calling her.
Okay.
Now she's in another call.
जाके सारे इकट्ठे हुए थे ना बंदा बम करा नहीं चाइना में ऐसे ही चाइना में उन्होंने मतलब जो उनके थे ये शादी का खत्म करने के लिए सारे लोग स्टेडियम में बुलाए
है ना, काफी बिस्किट गिरे। हाँ वही तो कह रही हूँ ना। नहीं 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 नहीं, रात को बाहर गिरा हुआ था, मैंने देखा था रात को ना, अभी भी बाहर गिरा हुआ है। या झाड़ू या कपड़ा ले आओ ना, पे भूल गई होगी ना, कोई बात नहीं, कपड़ा तो।
जी डॉक्टर शीला, आर यू हियर?
कैन यू हेयर मी?
या आई कैन हियर यू नाउ।
फाइनली जी।
योर
या
पिक्चर इज
कैन,
डॉक्टर
शादिया,
शीला,
जी जी।
डॉक्टर शीला, आपका पिक्चर नहीं आ रहा। योर पिक्चर इज नॉट विजिबल।
मैं तो सामने ही बैठी हूँ फोन के। देखती हूँ अब आ रहे
Okay,
हैं।
no, now it's
चलो
visible.
जी जी।
That's better. Okay, before going at the backstage, just I want to have two more questions in my mind. That's one is Dr. Sheila, I want to know about that vitamin D supplement can treat the depression or the improve the mood. Is it true or the false? Is there any connection between vitamin D supplements?
मूड एलिवेट, मूड तो ठीक कर देता है, बिकॉज स्ट्रेस के लिए है ना,
जी
स्ट्रेस को जब ठीक करेगा तो
जी
मूड
जी।
ठीक हो जाएगा। दूसरा क्या
हम्म।
सवाल था? कैन इंक्रीज
Vitamin
व्हाट?
D supplements are good for to improvement of the mood, or it
यस
will be we can feel
यस,
better by taking
इट
this
इज गुड,
supplement.
बट नहीं, इट इज गुड, बट इफ इट इज विटामिन डी रिलेटेड डिप्रेशन और स्ट्रेस,
Mm-hmm.
अगर उसको
Okay.
कोई और प्रॉब्लम है साइकोलॉजिकल,
जी जी।
नॉट, तो फिर तो मैं नहीं कह सकती ना कि वो साइकियाट्रिक प्रॉब्लम्स को भी विटामिन डी ठीक करेगी। इट इज
Mm-hmm.
ओनली बिकॉज
Okay.
इफ शी इज डेफिशिएंट, then these symptoms come along with its stress.
Okay. Fine. Okay. One more question we have that vitamin D. It's just I'm going through the with the theories that it helps to improve the in blood clotting. That's very necessary for the bones and the teeth. What do you say about this?
Blood clotting factors,
जी, ब्लड क्लॉटिंग फैक्टर्स जो हमारी बॉडी के लिए
उनके
जरूरी हैं।
लिए, उनको बनाने के लिए it is
जी
like
जी।
the intermediate. Yes.
ओके। Okay, Dr. Sheila, next I want to know about these
आपका
factors
ये
that we
सवाल था, आपका इस सवाल का जरा और जरा क्लियरली पूछें, बिकॉज देखिए ये इंटरमीडिएट के लिए होता है, एंड टू
जी।
प्रोड्यूस द ब्लड क्लॉटिंग फैक्टर्स, बट
हम्म,
डायरेक्टली, मतलब दिस इज नॉट द ओनली वन जिसकी वजह से ब्लड क्लॉटिंग फैक्टर्स इफेक्ट होते हैं।
सही सही।
मतलब ये
अच्छा
दिस हैज टू
अच्छा।
बी वेरी क्लियर।
हम्म।
आई होप
अच्छा
इट इज
वन
क्लियर,
मोर।
बिकॉज देखिए जो ब्लड क्लॉटिंग फैक्टर्स हैं वो
जी
जेनेटिकली
जी।
भी डिटरमिन्ड होते हैं, वो और भी प्रॉब्लम्स हो सकते हैं। सो ये इंटरमीडिएट है, डज नॉट मीन कि सिर्फ इसकी वजह से ब्लड क्लॉटिंग फैक्टर्स इफेक्ट होते हैं।
हम्म।
यस, अगर ये डेफिशिएंट है तो वो उस पे इफेक्ट होता है, एंड इफ यू गिव इट तो दे इम्प्रूव, दैट इज हाउ इट इज रिलेटेड।
सही। अच्छा
हाँ, ये नहीं हो
लास्ट
सकता कि
वन।
कोई कॉज कोई और हो, लाइक जेनेटिक हो या कुछ और हम कहें कि जी
जी जी।
ब्लड ये विटामिन डी दे के ठीक हो जाएगा, तो नो।
सही। ठीक। सही हो गया। अच्छा जी, एक और मतलब हमारा क्वेश्चन है कि लास्ट वीक हमने पूरा इसके ब्रेस्ट कैंसर अवेयरनेस के हवाले से बात की, और नाउ वी आर गोइंग टू कंसिडर दैट विटामिन डी कैन हेल्प टू रिड्यूस द ब्रेस्ट जो है ब्रेस्ट कैंसर। क्या ये रिलेट करता है, एक दूसरे से इंटरलिंक्ड है?
ब्रेस्ट कैंसर की ना, देखिए ब्रेस्ट कैंसर की ना इज लाइन ऑफ कॉजेज रीजंस, ठीक है, ब्लड
हम्म।
कैंसर ब्रेस्ट कैंसर के लिए देयर इज लाइक,
जी।
इफ आई स्टार्ट टॉकिंग अबाउट इट तो ये कोई अबाउट 20 हैं, ठीक है, इसमें तो हर चीज ही आ जाती है ना, इसमें तो एनवायरनमेंट भी आ जाती है, हवा भी आ जाती है, इसमें सब कुछ ही आ जाता है। तो डेफिशिएंसी ऑफ एसेंशियल विटामिन्स, यस, and minerals, yes, they play a role in preventing a lady from breast cancer. Yes.
Fine. Okay, Rashida, I just want to know about the advice of the day, what you want to recommend for the women or the sisters or whatever. Means अगर हम gender discrimination ना करें,
लाइक अगर ये डेफिशिएंसी मेल्स में भी हो सकती है, फीमेल्स में भी हो सकती है, तो आप क्या
फीमेल
रिकमेंड
में
करेंगे?
ज्यादा है, फीमेल में ज्यादा है।
अच्छा। सही। तो आप इसमें क्या
देखिए
रिकमेंड
एडवाइस
करेंगे,
मेरी
किस
यही
एडवाइस
है,
है?
शादियां देखिए, एडवाइस मेरी यही है कि अपनी लाइफस्टाइल को इस तरह हेल्दी लाइफस्टाइल में आए।
सही।
हेल्दी लाइफस्टाइल में क्या है? हेल्दी लाइफस्टाइल में एक्टिविटी है, हेल्दी लाइफस्टाइल में वॉक है, हेल्दी लाइफस्टाइल में
हम्म,
एक्सरसाइज है, एक्सपोजर है टू सनलाइट, हेल्दी लाइफस्टाइल में ये सब
हम्म,
है। आप देखिए हम शुरू से कहते हैं कि बच्चे को थोड़ी देर के लिए धूप में बिठाओ या बड़ों को थोड़ी देर के लिए धूप में
हम्म,
बिठाओ। ये हमारे तो शुरू जनरेशन पहले से भी चल रहा है। बट द थिंग इज
जी।
कि अब हम बहुत ही ज्यादा फंसी हो गए हैं कि अब हमें धूप को डिसलाइक ही करना शुरू हो गए हैं।
हम्म,
नंबर दो
हम्म,
ये है कि फूड ऐसे खाओ जिससे जो हेल्दी फूड ईटिंग। सॉरी, हेल्दी फूड ईटिंग हैबिट्स जो हैं
हम्म,
उसमें ये देखो सारी हेल्दी फूड ईटिंग हैबिट्स क्या हैं? अगर हम सिर्फ विटामिन डी को भी एक तरफ रखते हैं, यू ओनली टॉक ऑफ हेल्दी फूड हैबिट्स। इफ you get indulge yourself into healthy food eating habits, most of these deficiencies will be covered. For example,
सही।
you take more fresh fruits, more vegetables, and add nuts, जैसे मैंने almonds का कहा है, nuts in your diet, few small helpings of nuts. डाइवर्सिटी ऑफ फूड में जाओ ना, डाइवर्सिटी ऑफ फूड इज आजकल द इन थिंग। डाइवर्सिटी ऑफ फूड में ये है कि डोंट स्टिक टू वन टाइप ऑफ फूड,
हम्म,
टेक अ वैरायटी ऑफ फूड। डाइवर्सिटी का मतलब ये है। अब डाइवर्सिटी
सही।
में जो आजकल हम प्रमोट कर रहे हैं पाकिस्तान में, बिकॉज ऑब्वियसली हर एक की रिसोर्सेज बहुत ज़्यादा नहीं है, पाकिस्तान
हम्म,
इज़ एन अंडर डेवलप्ड कंट्री और पावर्टी रेशियो इसमें बहुत ज़्यादा है। इसी तरह डेफिशिएंसीज भी बहुत ज़्यादा है, because of the mainly the reason that these people can't afford to have all that food variety and all the food
हम्म,
quality and all that food जो हमें चाहिए, जो हम बताते रहते हैं। सो इसमें डाइवर्सिटी ऑफ फूड में जाएं। अब डाइवर्सिटी ऑफ फूड में ट्राई टू गेट अ मिक्स ऑफ थिंग्स एवरी डे। उसमें हर्ब्स भी हों, उसमें वेजिटेबल्स भी हों, उसमें सैलड्स भी हों, उसमें ये फ्रूट्स भी हों, नट्स भी हों, और तरह तरह की वेजिटेबल्स हों, हर तरह की दालें हों। सो दिस इज़ लाइक अ वैरायटी ऑफ डाइवर्सिटी जिसको हम कहते हैं ना, ये फूड में जाएं। तो डेफिशिएंसी जो हैं इसमें कैंसर, अब इसका जो इफेक्ट है वो क्या है? कैंसर भी कम होता है, आपकी इम्यूनिटी
जी।
बढ़ी होती है, आपकी डेफिशिएंसीज कम होती हैं, आपको डेफिशिएंसीज के सिम्टम्स कम होते हैं, आपको स्ट्रेस नहीं होता, आपको यू आर अ फाइटर, यू हैव हाई इम्यूनिटी
हम्म,
एंड ऑल द गुड थिंग्स। अब अगर हम डाइवर्सिटी के अंदर हम कहेंगे जी फूड वैरायटी, अब फूड वैरायटी में फिश भी आ जाती है, बीफ आता है, मटन
जी।
आता है, चिकन आता है, फिश आता है, शिकार आता है, बर्ड्स आता है, इस एवरीथिंग इज देयर। एग्स आता है, एग्स प्रोटीन, एग्स आता है, मिल्क आता है, डेयरी प्रोडक्ट्स आते हैं, देयर ऑल सोर्सेज ऑफ प्रोटीन। अब अगर एक खातून ये कहती है जी मुझे दूध नहीं पसंद, मुझे मछली नहीं पसंद, मैं तो सिर्फ ये, मुझे चिकन भी नहीं पसंद, मुझे तो बस ये कीमा पसंद है, यू नो दिस सॉर्ट्स ऑफ वेरी हाई सिलेक्शन से ये हो जाते हैं कि फिर उनको डेफिशिएंसी शुरू हो जाती है। हाई सिलेक्शन तो होगी पर डेफिशिएंसी शुरू होगी ना फिर, बिकॉज ये
सही।
हर चीज, हर आपको एक चीज कंप्लीटली आपको सपोर्ट नहीं करती आपकी न्यूट्रिशन। दैट इज वाई वी से कि गो इनटू डाइवर्सिटी, सो दैट आप में ये जो है ना आपका ये, कि आपके जो चांसेस हैं न्यूट्रिशन में किसी आइटम के कम होने के, वो कम हो जाते हैं, वो
सही।
आपकी डेफिशिएंसीज का चांस कम हो जाता है। अब डाइवर्सिटी में जो मैं रिकमेंड बड़ा स्ट्रांगली आजकल कर रही हूँ, क्योंकि ये लेडीज नहीं सुनती और ये अपनी बस उनको अपनी मर्जी, अपनी मर्जी करनी थी। मीठा, अब मीठा ये बहुत खाते हैं, मीठा इज अनदर डिसएडवांटेज इन द डाइट। जितना आप रेडी शुगर खाओगे, मोनोसेक्राइड्स, उतना ही आपको आपके सारे ये लेवल्स कम होंगे, उतनी इम्यूनिटी ड्रॉप होएगी। ये तो एक और रिलेशनशिप है जो हम अभी बात नहीं कर सकते, बिकॉज इट्स अनदर बिग सब्जेक्ट। लेकिन
हम्म,
डाइवर्सिटी का मैं बताती चलूँ कि जैसे हमारा एक लोकल स्टेपल एक तरीका है डाइवर्सिटी ऑफ फूड खाने का, विच इज पंजीरी। अब पंजीरी में एटलीस्ट 20
सही।
आइटम्स डले होते हैं, 20-25 आइटम्स भी डले होते हैं। इवन
हम्म,
इफ वी हैव लिटिल डेवलप ओनली दिस हैबिट कि हम एक चम्मच पंजीरी का रोज खा लें, द लेडीज
सही।
खासकर, एवरी डे फ्रॉम द वेरी बिगनिंग, तो इनकी जो हम डिलीवरीज के बाद खाते हैं, नो, यू स्टार्ट फ्रॉम द वेरी बिगनिंग, तो आपकी डेफिशिएंसीज में जाने के चांसेस भी कम हो जाते हैं। बट दिस इज लाइक एन ऑनगोइंग लाइफस्टाइल मैनेजमेंट। ये नहीं हो सकता कि आज खाओ तो कल ठीक हो जाओगे। इट इज अ डेवलपमेंट ऑफ दीज आइडियाज एंड हैबिट्स इन योर डाइट एंड इन योर लाइफस्टाइल, देन which pays you back। ये अदरवाइज फिर एक ही बात है, फिर आप फार्मास्यूटिकल प्रोडक्ट खाओ और उसे अपनी रिकवरी करो, अपनी डेफिशिएंसीज कम करो, but then obviously then you come down to that, because overnight कोई और चीज ठीक नहीं करेगी सिवाय आपको दवाई के। और ये विटामिन डी भी इज लाइक फार्मास्यूटिकल प्रोडक्ट ना, आपको भी लेनी पड़ती है टू कम आउट ऑफ योर डेफिशिएंसीज। तो लाइफस्टाइल मैनेजमेंट अच्छी तरह करो, डाइवर्सिटी में जाओ, कोई फूड अवॉइड ना करो, हर फूड के छोटे छोटे अमाउंट्स खाओ, एंड देन and go for a variety of food and activity, and that is that's the message for all the women.
Thank you so much, Dr. Sheila, for your precious time. I know your schedule is too packed, but thank you so much for today's session. And
Thank you.
inshallah, it's a really great honor for me that I have a session with you. Thank you. And stay blessed.
Thank
Allah
you.
Hafiz.
Thank you. Allah Hafiz. ਇਹ ਲੱਭਦੀ ਪੈਸਾ ਨਹੀਂ ਮਿਲਦੇ ਪੈਸੇ ਸਵੇਰੇ ਦੇ ਮੈਨੂੰ। ਅੱਛਾ ਹੁਣ ਕੌਣ ਹੈ ਬਾਹਰ? ਮੈਂ ਤੇ आज तक मैं गलती करनी नहीं ना ऐसे टेलीफोन ਦੇ ਉੱਤੇ। इतना बजता है आंसर फोन, इतना बजता है। बाबा ने नहीं अंदर रख दो वापस। बाबा ने फोन कर करके मेरे को डिस्कनेक्ट हो जाता है ना।
कह रहे वॉइस नोट भेजो, मैंने भेजा है कि वो सही नहीं है।
हाँ
आपने
इतने
भेजा
फोन आते हैं, इतने
वॉइस
फोन
नोट
आते
आपने
हैं।
भेजा?
कोई नहीं बात अब।